Hi, Cam followers. Thank you for joining us this evening. I'm Nicki, and as you can see from the label there, we have Dr. Chris Zink from Maryland. And I always say it wrong because all English people say it wrong. How is it? Maryland.
Maryland, like Marilyn Monroe.
Maryland. Maryland.
What with a D on the end?
Really pleased and really excited to have you on. Thank you for joining us. I'm going to ask you if it's okay to do more of an in-depth introduction because there's so many things that you've done. Obviously, you are a vet. You are heavily involved with the canine sports and rehabilitation medicine in the States, aren't you? But before we carry on, I just want to say thank you to Big Barker, who have been sponsoring some of our lives. I'm just going to put on their little video here for their Big Barker beds. We always show this at the beginning. We really believe in these beds, and we know they're really comfortable. And as you can see here, the size of them, they look super squishy and comfortable for the dogs there. So thank you very much to Big Barker. Without further,
there's a poster that I just saw last week showing improved pain, reduced pain, improved mobility, and with orthopedic beds for dogs significantly.
Yeah.
I want one of those.
I know that every time I see that, I think, why not? They look so comfortable. And it's really great that it's got to the point in the arthritic journey where we're doing research into beds, dog beds making a difference. Yeah. So, yes, we'll come on to those kind of things. But would you mind introducing yourself, just telling us a little bit about how you've come to where you are, and then we will go on.
Okay. Hi, everybody. Let's see. I graduated from vet school in a decade so long ago, we don't mention it anymore. I was in private practice, in general practice for a couple of years, went back and did a PhD in macrophage biology, which is actually macrophages are one of the cells that influence arthritis quite significantly. I then I'm Canadian, and I came down to the United States to stay for just a couple of years and do a postdoc at Johns Hopkins Hospital. And I've been here for 35 years. And I was a professor at Johns Hopkins studying what HIV does to the brain, because actually HIV infects macrophages. But all at the same time, my real passion has been canine sports, canine athletes, canine rehabilitation. And so what I was doing in my copious free time was studying everything I could find out about dogs and dog athletics and sports, putting it all together, writing books, making videos, etc. And ultimately, I and a group of 12 other people worked together to get veterinary sports medicine, that's for both horses and dogs, and rehabilitation considered a specialty in the United States, one of the newest veterinary specialties. It's now an official deal. That's what the DACVSMR after my name means. I'm a specialist in sports medicine, veterinary sports medicine, and rehabilitation. I am also a dog sports competitor. I've competed with numerous breeds, from the biggest to the littlest, in many different sports. Actually, I have titles. In the United States, we get titles in the sports, like getting some initials after your name. Those are initials after the dog's name.
Oh, really?
And yeah.
But not just a rosette or a trophy. You actually know.
No, they actually, and it's on their pedigree now that they have accomplished those things. So I've gotten over 200 titles on dogs from 5 of the 7 different groups that we categorize dogs into here in the United States. So that's my passion one of my passions in my spare time.
Do you ever get to sleep, or is that not really necessary?
I'm just one of those people. I just have to be active all the time. I think maybe I have some kind of ADD or ADHD that never was diagnosed or something.
Yeah. But so you started so humans and dogs that really aren't. It's just everything's going on. But mainly dogs now. Is that right?
My passion. And yes, I retired from Johns Hopkins in 2015. So for the last 8 years, I've just done exclusively dogs. That I'm teaching, as well as seeing dogs clinically.
So webinars you're doing, we're going to share a couple of the links for some of the webinars you've done as well. So there's a recent one on the senior dog, which will be really interesting for anyone. So I will pop those on as we go through. If you have any questions, as always, please do pop them down. I'll keep an eye on the comments there, and we'll try and bring them in when it's relevant. But yeah, let's get started. Really, we're just going to pick your brains about how you do things and how you teach, because you teach this canine sports medicine and rehabilitation course, don't you? That I want to do, but unfortunately it's not run in the UK, so we would have to come across to the States to do it. But it's really popular, and there aren't many courses around for vets. So yes, let's pick your brains while we have you. What's your opinion? Let's start the overall view of arthritis. You obviously see a lot of it.
I do. So I want to say, like, I think the most important thing for us to know in terms of the big picture is that many dogs are living with arthritis and not necessarily showing us any clinical signs. They just, if you could ask them, they would say, oh, yes, I'm very painful in my elbows and in my hips or whatever else, but I guess that's just the way it goes. They don't. I think that it's one of the most underdiagnosed and undertreated conditions in dogs. Absolutely. And not even, I mean, certainly in older dogs, absolutely, but not just in older dogs. And dogs that are really active, and more dogs are more and more active all the time. And I don't just mean in formalized dog sports, but anybody who comes home at the end of the business day and throws the ball for their dog for a half an hour, that's a dog that's really, really active.
Yeah.
And more activity, especially activity where the dog is kind of moving abnormally, have more risk of arthritis. So we look at arthritis as having two kinds of causes: an abnormal use on a normal joint, which would be the dog that really, really retrieves until it's exhausted, and all the time it's retrieving, it's falling all over the place and grabbing the ball or the frisbee or whatever. And then there are dogs that have normal activity on abnormal joints. So that would be dogs that have hip dysplasia, elbow dysplasia, or whatever, or even chondrodystrophic dogs, like the chondrodystrophic dwarfs, such as corgis. Yay, Queen Elizabeth. And other dogs that are, by their genetics, maybe they have misfitting joints, malorganized joints.
Yeah, we do have a lot of them in the UK. We have a lot of people that like the look of dogs that have bad joints, and it's not their fault. It just is the way they are.
It just is, how they're put together.
Yeah,
and so the really critical thing I feel is that we should be screening dogs for arthritis a lot, and we don't, because you can't necessarily depend on the dog showing you. And I think that arthritis screening should be a part of annual checkups after a certain age. Just standard. I mean, radiographs are one of the least expensive things that a person can do diagnostically for their dog. And so I think it's very important, maybe after the age of 8, for example, that we get, that we do radiographs on, let's say, elbows, hips, and toes, which probably are common sites.
Yeah. Yeah. But it's kind of, so that's down to the
risks too.
Yeah. But it's kind of down to the vets then saying, I think we should do this. And actually sometimes it's about education.
The owner thinks, I think we need to do this.
Yeah.
Sometimes, because the people who the people that have their dogs are like a triage nurse. They're the ones who really are in control of, in many ways, what gets done to the dog and how whether this is diagnosed, etc.
Yeah. No, I would agree. It would be great if we could just do that as a standard, or even just start to have questionnaires maybe that we're giving people when they come in for their annual checkups, just to see if there's any red flags that may make us think, well, actually, we should be looking into this.
But also from the point of view of veterinarians, we should always be examining all of their joints. We should be testing them for, elbow flexibility, extension, and flexion, carpus, toes, palpating, to see if we detect any areas of restricted flexion or extension or pain as part of our clinical exam. And I think in veterinary school, we really don't, the musculoskeletal system kind of gets short shrift because I don't know why, but there's so many other things that can be going wrong, kidney disease, liver disease, etc. But I think musculoskeletal needs to be really thoroughly checked as well.
Yeah, no, I think you're right. And when you do talk about things like that at vet school, it's about fractures and how you're going to fix that and what happens, if you need a place here and actually the things that we're probably not going to be doing every day. And when you think about how many dogs have arthritis, I mean, you were saying before we came live as well that you have an 11-year-old golden. Is he 11? Did you say?
Yes, he's 11. Yes.
But you don't know that he has arthritis, but you kind of assume that you're probably that you need to start implementing some changes
to check in particular. Yeah. And people think. So this is one of my pet peeves. The older I get, the more I'm peeved about it. Because people. So let me give you an example. I was in California a year ago, and a woman was showing me a video of her German Shepherd. She was so proud about this German Shepherd. And he was doing nose work, which just is, involves walking around a facility and scenting various things. And I looked at him. I thought, oh my God, he looks like he's in pain. And I told that to her, and she said, oh, well, he's 9 years old. I mean, and I'm like, what? Why would we assume that older dogs should live in pain? Do we assume that older humans should live in pain? No. And it's just not a normal, it might have been a normal part of aging decades ago, but we have so many things we can do. I don't consider it a normal part of aging at all.
No, but it means that somebody has to tell them, doesn't it? Because I think like that person, they do just think, oh, my dog's old. It's okay. Yeah. It's probably not painful. And, people will say, oh, he does limp on that, but he's not painful. And you want to say, and I do say, well, if he's limping, he is painful. Otherwise, he would not be limping.
Yes.
And I think it's sometimes something that you have to bring in gradually rather than your dog is in pain. We must do this, this, and this, because people don't respond well to that. So it's working together, isn't it? And getting them around to thinking and looking for those things that you are seeing already.
Right. I kind of sort of dump it on them. Say, your dog is in pain. Do you want to be in pain all the time? Well, your dog is experiencing that.
Go and see your vet immediately.
Yeah. I'm not that subtle, I guess.
No, well, and I think you're right, but I do think I find it quite difficult to still want for those people then to come back and trust me without then telling them, you must do this and this. But it is really important, isn't it? Because the earlier you treat these dogs, the longer they're going to have. That's how I like to explain it.
That's really, really important. That's really important. So you want to catch it you want to catch it early. And what I would say is that if a dog's limping, barring some kind of an acute injury in accident, if a dog is limping, they've had this going on for months, if not years.
Yeah.
So that's not a very good way to detect arthritis. The thing to do is to look for really subtle changes, like the dog doesn't want to go upstairs, or the dog's refusing to get into the car without help, or the dog doesn't like to get up on the couch, or for subtle little things. Or you notice that when he's sleeping and then he gets up, he's kind of really stiff, or those are all the kinds of things we should be looking for long before there's a lameness.
Yeah. And I think that it's one of those things as well, that if it happens very gradually, you don't always take note that that's happening.
Right.
And it's only when you reflect that you realize.
Exactly. And then sometimes I'll say, like on a clinical examination, I'll say, your dog's, let's say his carpus wrist is swollen, and does he do? And then I'll start asking questions. I'll go, he really doesn't like getting in the car anymore. I thought maybe he was car sick, but no, he just doesn't want to get in, but then he's fine. And no, he just doesn't not been getting up on the bed lately, now that I think about it. And so these are all retrospective recognitions of problems.
But how do you get people to think like that before it happens? How do you get people to know these things? That's the hard thing. Whenever I first meet a client, one of the things that I always tell them about, so
So for the decades that I was at Johns Hopkins Hospital, it's in the inner city, and there's a lot of poverty there. There's a lot of people that don't have medical insurance, unlike more intelligent countries like Canada and Britain. But anyway, and so the people there use the emergency room, the emergency clinic, as their doctor.
Right.
And so what ends up happening is you end up with all of these people at the emergency room. Some of them just have a cold, and other ones have been shot. So there's, and so there's this nurse there that decides who gets to go in right away, who doesn't. Okay. Or who's just drug seeking or whatever other things that they're doing. And so, but that nurse is every one of us that has a dog. So every one of us is like the triage nurse. And we need to be watching all the time. And so I tell my clients this, and I say, look for all those behaviors. And anytime you see a change in behavior, don't dismiss it.
Yeah.
Think about what it might mean, and even write it down in a journal, how many times you saw it. If you only saw it once, well, maybe it doesn't mean anything.
Yeah.
If you consistently start seeing these things, then you really need to follow up on it.
Yeah. Yeah. And I think sometimes it's easier to see these things in dogs that do sports and like agility dogs, because there'll be other people watching, won't they? But when you're just out walking your dog yourself and other people aren't seeing, aren't commenting, you really do need to write them down. If you just think, oh, that's a bit odd that he did that, just jot it down.
Yeah. Writing it down, keeping a tiny little journal in your kitchen where you keep the leash, stuff like that,
Yeah, it's a really good thing. And actually, I'm just going to pop this comment up here from just as Facebook user. Sorry, I don't know what your name is, but I think this is a really good point, because we're talking about you go to the vets, and the vet should be doing as part of their annual checkup. But as a canine therapist, he's written, I love the idea of arthritis checks as part of a yearly health check. As a therapist, the relationship between vet and other paraprofessionals is crucial for catching arthritis. And I think you're right. I mean, I've had one quite recently where an older dog has been going to hydrotherapy, and they take their other younger spaniel with them. And the hydrotherapist commented, that leg just feels a little bit funny. And then they've come to the vets and said, that's been commented on. Can you have a feel and see what you think? And actually, I agree that there's things that we should be doing there with that dog. So no, you're right. Absolutely. It's not just down to the vets and owners. It's down to other places where dogs are going. There's a good point. So yeah, Dawn and Kath are writing here. They have a pain diary for their dog, so I don't forget a sign I've noticed, as it's so easy to let things slide. Yeah, absolutely. It's a really good thing to start doing if you don't do it already. Or even if you're out and you maybe don't have your diary or something to jot it down on, take a quick video or a picture of what they're doing, so that it's a memory to then jog your memory when you get home.
Yeah, I think that's really important. I love the idea of just having a little notebook next to the leash. Did you see anything? You can keep track.
Yeah, definitely. And then the owners, sometimes it is down to you to come in and say, I'm not happy with my dog, it's doing funny things. You don't have to wait for a vaccination appointment, an annual health check vaccination or whatever. You can, if you're worried, get it checked out. It's definitely a good thing to do.
If you've ever had chronic pain, like any of you that have ever had chronic back pain, for example, it's just on your mind all the time. It affects everything that you do, and it affects your quality of life. What we want for our dogs, ideally, is to have quality of life till the moment they die. So that would be what we call health span, where the dog is healthy right up until the end. And all of us know that, we talk about lifespan. If you live to be 95 or whatever, I personally don't want to live to be 95 if the last 10 years of those are unhappy and poor quality of life. It just doesn't, it doesn't make any sense. So, so arthritis is a huge thing that affects quality of life in dogs.
Yeah. Yeah. And you see it. It's not just the physical signs, is it? Like you've just said, it drags you down pain.
Yes, and all kinds of other things. It slows your learning. It affects all of the things you do. Even if, what if it hurts to bend down to eat your dinner?
Yeah.
I mean, it just, it really frustrates me that it's so underdiagnosed and undertreated.
So what do you say then if somebody does come in and says, do you use that? Your dog, do you want your dog to be in pain the whole time? How do you approach that? How do you say it to
I
them?
do. I asked them, I said, have you ever had an instance where you were in chronic pain for some time? And then they tell me about it. And I say, you know what? That's what arthritis is like for dogs. Most people will say something like, well, yeah, my knees have been killing me for years, stuff like that. And I had to have a knee replacement or whatever other things. And I will use that personal experience as an example for them.
Yeah. And what do you think is the main reason why people do just say, oh, it's just old? Do you think it's because they don't want to spend the money, or they don't want to accept that their dog maybe has got a disease going on?
You know what? I think that was an old-fashioned belief. I think in some ways we were brought up with that before we had all of the multimodal treatments that we have now for arthritis, that it was just, even with people, it was just like you lived with it.
Yeah.
So I think it's kind of a belief that, I don't know, that we got from our parents or that we got from societal impressions over time. And I that's why I try to bring it home to the dog, to the person personally. How would it feel if you felt like this all the time? And then they take it in, they understand better.
And when do you start talking about it? I know you're not in general practice anymore, but if a dog comes in, do you talk about conditioning the dog? Because I know obviously you do a lot of canine sports. Do you talk to people you're with about not waiting for there to be arthritis, but to start conditioning now?
A lot of issues about preventive. So weight management, huge.
Yeah.
Weight management is huge. And then exercise to support the joints. Even dogs, it's amazing, because even if you have a dog that has, let's say, hip dysplasia, and it's a relatively mild hip dysplasia, that dog can, with proper management and fitness to help to hold the joint together, and proper use of exercise and not over exercising, you really can stave off the development of arthritis well into old age, maybe forever.
Yeah.
It's pretty amazing.
Yeah, because surgery isn't always an option for these things, is it? I know some people, if you're a person, they think, well, if I've got dodgy hip, I'm just going to get a hip replacement. But that's quite a big thing to do in a dog. And actually, there may be other ways that you can manage that without having to go for surgery, or knowing about it in advance so that you can prevent that from happening.
Yeah, definitely.
It's really important. I just got a comment here from Gail.
Yeah, well, that's really cool. She noticed that something was slightly off about the paw prints. What you might see is some drag marks, for example.
Yes.
Or you might see one print is way larger than the other one because they're bearing more weight on that side than the other.
Yeah.
I love looking at paw prints in sand or mud.
Yeah. Yeah, we have had a lot of snow in the UK recently, and so the fact that you saw it you put there in wet or mud or snow, you do notice definitely in the snow with the pressure going through it, the difference. You don't need a stance analyzer to do that, to see where they're weight bearing. And then
it says her dog's 6.5 years old, so great that she caught it at that early age, because now she can stave it off and she can prevent. Our whole goal here is, once it's there, you're probably not going to be able to do anything about what is there in terms of bony changes and everything, but you can delay its progression so much that you almost stop its progression.
Yeah.
And that's the goal then.
And just little things like you've just said, the biggest thing, weight management, which we talk about till we're blue in the face. If you've got an overweight dog, you can throw whatever you like at it and spend all sorts of money, but ultimately the weight loss is going to make the biggest impact for that dog's pain and comfort. Natalie's written about what other behaviors could be displayed even if the dog keeps on seemingly happily running, doing the stairs, no limping, etc. Could a new grumpiness be a clue to explore? Absolutely.
Yeah, absolutely. What are some of the other behaviors that we see? Honestly, I look at any change in any behavior, because it might be things like, for example, a dog pawing at something, or licking. Sometimes dogs will lick their joints or their toes. And maybe you think, oh, he just has a little bit of allergies. Well, might be actually arthritis because he's experiencing pain there. Sometimes nipping at themselves. They'll suddenly go like this and start biting themselves.
Yeah.
That's a thing that I see oftentimes with hip dysplasia, that dogs will start biting at their hips.
Yeah. And you often put it down to maybe anal glands or, itchy around their bottoms, but actually you clear the anal glands, they're absolutely fine. And then, it turns out that it's a pain thing.
Yeah.
Absolutely. And then
nails wearing unevenly, that's another common one. Yeah.
Difference in the nail length. And the other one that I've seen a couple of times is when people say, oh, I don't know what happened. He used to be okay with me trimming his nails, and now he doesn't want me to hold the foot up to trim his nails.
Yeah.
Or he doesn't want me to hold the foot up to dry his foot when we come in from a walk.
Yeah. Yeah, those are good ones too.
Yeah. And because I think digital arthritis is quite, I know it's underdiagnosed. The whole arthritis picture is underdiagnosed, but digital arthritis.
It's very common. It's extremely common, and nobody's looking. Sometimes, a lot of times a veterinary examination stops at the carpus and the hock, and they're not looking at the feet. We really need to manipulate those toes and see what they feel like.
But I think it's because dogs hate their toes being touched, especially at the vets, because they think we're going to go and trim their nails. And it may be actually that's an association from the pain that it causes before you even dip the nails, that it's that's happening. The link's very closely with changes in behavior at the groomers too. Yeah. Your groomer may say to you,
he doesn't want me to do this or that or the other thing because you're holding the leg in a way that is abnormal and is painful. Or abnormal to their normal motions, like if they're lifting the leg up to do something. Yeah.
And then another one, non-compliance trimming on a once compliant dog was a huge indicator. Yeah. I didn't understand for so long and caused her pain. Sorry, I'm going to pop this one up, Sonia, that it didn't realize and then suddenly twigged, oh, that's why you're then reluctant for me to clip your nails. So silly little things sometimes. You just think, oh, he's being old and a bit grumpy about that. No, it's probably...
And anyway, who said we all have to get grumpy when we're old? I'm kind of offended. I'm getting old, and that doesn't mean I'm necessarily getting grumpy.
No, and I'm not particularly old, and I'm always grumpy. So there we go. There's no correlation with that. Joe's has written here, in human orthopedics, many surgeries require, if appropriate, weight management and prehab with physio, as well as post-op rehabilitation. It would be amazing if this could happen in the veterinary world too, and not just refer to physio if recovery isn't optimal. Yeah, I think you're right.
So I'll tell you a personal story. So I used to weigh 60 pounds more than I do now.
Oh, wow.
And I had terrible knee pain, and I was getting steroid injections, and it was really awful. And then I have never had knee pain again since I've lost the weight. I have had none, zero, zip, nilch, none, because it was all about the weight.
Yes.
So
our joints and dogs' joints are not made to carry that kind of weight, are they?
No. So yeah. And here's the good thing. It's a heck of a lot easier to take weight off your dog than it is to take weight off yourself. So that's the good news.
Yeah. And free. It's cheap.
Yeah. You'll save money.
Yes. Yes. So treatments, where do you start with your treatments for your dogs with arthritis?
So I think the most important thing to recognize is that there isn't just one treatment, but there are many causes of arthritis, or there are many components that work together to make arthritis more painful. And so what we want to do is we want to attack the issues at multiple locations, at multiple sites. Obviously weight loss is one, pain management is another. And even with respect to pain management, there are many different ways to manage pain. Support through supplements that help to, and when we think of supplements, we think that it's extras. Well, actually, it turns out that, for example, a supplement like omega-3 fatty acids, it has an amazing ability to reduce inflammation, which is the big cause of pain and arthritis. So what happens, what the omega-3 fatty acids do, so anytime you have cell damage, the cell membrane breaks down. And there's a molecule that gets released called arachidonic acid, and that's at the very top of a whole cascade of inflammatory mediators that get released and that cause all of the signs of inflammation, swelling and pain and heat and all those other things. Well, it turns out that what omega-3 fatty acids do is they travel along and they go into the cell membrane and they kick out arachidonic acid and replace it with themselves. So you don't even have as much arachidonic acid available. So it's right at the top of that whole inflammatory cascade. Yeah. From my point of view, every single dog should be on animal-sourced omega-3 fatty acid supplements from every age, at any age, because it's going to be there at the beginning of every inflammatory response that is, and to help reduce all those clinical signs.
Yeah. So omega-3 fatty acids, for anyone who's not familiar with them, they are in, well, I don't know what it's like in the States, but they're in some joint supplements. And as far as I understand it, they're probably the ingredient in those joint supplements that you're looking for over your chondroitin, glucosamines.
It's the most important component. And frankly, I wouldn't use it I would use it exclusively as a supplement by itself. If you're going to use chondroitin and glucosamine and all those, good, but you should feed either a fish oil or krill oil, or there are marine algae. There are many different sources. You have to use an animal source. Things like flaxseed and other plant sources are not sufficient. The dose that your dog should get is 100 milligrams per kilogram of a combination of the two most important omega-3 fatty acids, which are DHA and EPA.
Yeah.
And that's a pretty high dose. So you don't want to use it as a part of some other supplement, because you'll never give enough of it.
Yeah.
It's quite, it should be on its own as a supplement.
Yeah, I'm glad you said that, because I do have those conversations with people. And I think because the marketing of some joint supplements is very, very good. But it's not very clear sometimes how much of the omega-3s are in those supplements. So I think what you've just said there,
you want to look at the bottle, read on the bottle. It'll say, if the bottle doesn't say how much EPA and DHA, don't buy it.
Yeah.
But when you do buy it, read the bottle. DHA plus EPA should equal 100 milligrams per kilogram. Your dose should make it equal 100 milligrams per kilogram of your dog's body weight.
Yeah, which is actually quite a nice number to remember as well. 100 milligrams per kilo. It's not, it's kind of in there. There is just a little question about the omega-3s, if that's okay, about dogs with prone to pancreatitis. How do you feel with those?
So usually with those dogs, what I'll do is I'll start them on the omega-3 fatty acids at a lower dose and work up to a higher dose. The biggest issue with pancreatitis is a sudden increase in fat.
Okay.
Like eating a big marrow bone or something like that, when that's not a normal part of their diet.
Yeah.
So I don't see it as an issue as long as you gradually increase it.
Yeah. Good. And I think that, again, I had somebody this week who wanted a supplement different to the one that I use, and it didn't have any omega-3s in it. And I said, I think we should use omega-3s, but if you want to use the one that's fine. But it's very difficult because, like you said about certain things, if you pay enough money for something, there is that placebo, that effect where you want it to work. So you see that it's working and then you stick with it, and you're not necessarily willing to try anything else. Yeah. So I'm happy that you've said that about the omega-3s.
Can we look at Amanda Perriman's question? Because there's she's asking in my book, I presume she means Discovering Your Dog. Did I have a favorite chapter or fact from writing it? And I got to tell you guys, with respect to the two most important chapters are chapters 24 and 25, which are about food and supplements. And it's all science-based. Really, really important. You guys cannot emphasize that enough. Those two chapters were written in conjunction with a board-certified veterinary nutritionist, the only one in the United States that has never been paid for by a dog food company.
Oh.
And that's an important, thing to think about with respect to bias, etc.
Yeah.
And so, but that's all of the information in this book is fact based, and those 2 chapters are really essential for every dog owner to know. Really.
So this is the book. This is it here, isn't it? Discovering Your Dog. Yeah. And we can buy that here on Amazon or somewhere?
It's available on Amazon. Yes.
Yeah. Yeah.
And it's also available, and it's available not only on Amazon, but it's available as an ebook on Amazon, so that you don't even have to worry about shipping. And it's also available as an ebook from my website. But it's also available as an audiobook with the author reading it.
Oh, really?
On Amazon too. So there are ways to get it without you having to pay for shipping.
Okay.
International shipping, is awful.
So this is the website here as well. So Dr Zink has the website for active dogs.
For activedogs.com.
I'm going to put that link there just now as well, because I have these here. I'm going to try and do this at the same time. I hope I don't lose anybody while I'm doing that. So that's the link for the website. But yeah, so there's the book, and then there's the other book as well, isn't there? Is that
the other thing that I have is an exercise, a video. It's a USB drive that, or it's available also available for download directly from Vimeo. And it's a set of 38 exercises for dogs. And the critical thing about that for arthritic dogs is that all of those exercises are virtually non-impact. In other words, taking your dog for a walk might not be the best thing for them, especially if you're, marching down the sidewalk with the hard pavement and everything, but rather supporting them through exercises that are non-impact or very low impact. For example, let me give you an example. So let's say you have a dog with elbow arthritis. One of the best things you can teach them to do is wave their paw in the air for 30 seconds, which usually the dog will kind of paw the air like that.
Yeah.
The other foot for 30 seconds and then repeat twice more. Well, that's completely non-impact.
Yeah.
But it really builds the shoulder muscles that have to support that limb to really strengthening. And those shoulder muscles are all surrounding the elbow. So
so that's is that on your website as well?
It's a Fit for Life videos that I showed you, and it's also on my website. Yes.
So the Fit for Life, here we go. I'll share those now as well. I'll pop these back on as a link in a second. So the Fit for Life, no, that's a Discovering Dog one. Sorry. Now where have I got? Stop sharing that. And
can I post something on the? Can I?
Yes, absolutely. Yeah, if you've got them there, that would be great.
Okay, I'm gonna post a comment. How do I do that? I see your comments, but I don't see how to post it.
You should just be able to, if you click on the bottom box where it says all.
I don't see that. I don't have the all.
Otherwise, you will be able to do it afterwards.
I'm going to just email it to you really quickly, Nikki. Is that okay?
Yeah, that's fine.
Because the reason that this is important is because I'm just going to, hold on, I'm just going to send it.
So Amanda Perriman's written like the high 9. That's what you're doing.
Yes, that's another one. That's not quite the same one. It's a variation of it. But Nikki, I just sent you the link for this online for downloading it streaming so that people don't have to pay for shipping across the pond.
I will jump on that
it's
now.
It's on Vimeo, and you can download it from Vimeo. Are you guys aware of Vimeo up there?
Yes, yeah.
Yeah, I did that because then you don't have to pay for shipping. And when you download them, you can copy them to your iPad, to your cell. You can look at them while you're doing the exercises, and really, really important.
Oh, that's really good. Yeah, so even those are kind of exercises are the ones, even if you haven't got
non-impact exercises targeted at the front legs, the rear legs, the core, or whatever part of the dog's body there might be arthritis. So that's actually really important. Yeah, so you've put that up there now.
So that's that's there now. So Ella's written here, it's coming up. My boy's orthopedic surgeon asked me to teach my dog to give high fives. So he would lift his forearms and exercise his elbow joints. Yeah, that's really interesting because I would be worried that it's going to hurt them to do that. But of course, they'll only do what they're happy to do, won't they?
Well, and when you're using really delicious food, there's a lot of motivation for doing it.
Yes.
And what we don't want to have is impact or forces, abnormal forces on those joints that are already painful. But it's usually not very painful just to raise the limb, but it supports all of the surrounding musculature that supports that joint.
Yeah. So in your book that you've written, the Discovering Dogs one, you obviously talking about nutrition and the exercises.
Yes. A lot about exercises and stretching and what's the best way to stretch dogs that are safe and that kind of thing. What are the best exercises for targeting different parts of the dog's body and other.
Yeah. No, that's
and it's
really
all, here's the thing. Anybody can write anything, right? If you can self-publish something and you can, and it's available to the public, but that book has all of the references in it for anyone who wants to see the reasoning behind what I said. And I think that's really, really important for us to be discriminatory that way, to differentiate between when we have data and when we don't, when we have known facts and when we don't.
Yeah. Yeah, because like you say, you can say anything that works for you, but yeah, you need to be. I think people just want to try things, don't they? And actually finding information about exercises you can do with your arthritic dog, I think is quite tricky. And people are really worried about doing the wrong thing. So to have something there with that evidence is really useful.
Really critical, We don't want to make mistakes.
No, because absolutely, they will absolutely pay for them. I've got another question here from Janine. It says, we don't have arthritis complaints, but we do have a neuro condition. Everything you talk about here really helps me consider best care for Tara currently around pain, but also to prevent arthritis. She's only 3.5.
Yeah.
But because if you have neurological problems, that is going to have an effect on potentially on
movement. I mean, it's going to affect movement, and we know that abnormal movement tends to lead to arthritis. So absolutely.
Yeah. So get in and do those exercises, and I think just keep hands-on, keep looking for things that may be happening that aren't to do with the neurological problem directly, but as a consequence of it, really. So do you always then say they come in? I know you're kind of seeing your mobility cases now more than anything, but when you speak to people, is that something that always comes up about the omega-3s? Just going back to that, just
absolutely. Yeah. So I have I always talk to people about nutrition and supplements, because it's one of the biggest things we have in our hands to be able to control, and it's one of the things that unfortunately we have the least factual knowledge about.
Yes.
And so it's a big, I think it's a really important thing to discuss and understand. And for us, like if you've ever, I haven't had a baby, but I understand from people who have that, that the new mothers are really neurotic appropriately about what they need to feed their baby once it starts going to food, once it starts, weaning to food. And, think about how important it is for that little growing body to have, to have organic food, and to not be taking in toxins, and to be taking in the right components of carbohydrates and protein and fats and whatever. I mean, it's just as important for dogs.
Yeah. Yeah. And well, yes, absolutely. Because when you have puppies that come in, it's one of my standard questions is what food are you feeding your puppy? And especially these large breed puppies that come in, that are maybe not on a specific large breed or just a normal dog food, not even a puppy food. It is really important to get it right in those early months, those early years, because it will have a knock-on effect if you don't get it right at that point.
Yeah. And then even in ongoing life, and especially if a dog has an abnormality. So think about this. There's a dog with your dog has arthritis, and there are all of these inflammatory mediators circulating around in the dog's body. And all of them are punching at that pain and increasing the pain and increasing the swelling and and making the new changes in new bone growth, and all of the changes that we see with arthritis. Food is a huge effect on that.
Yeah.
You can either feed the arthritis, or you can feed to prevent it.
Yes.
And slow it if it already exists.
Yeah. So diet, supplements, weight, three big things already.
All under your control.
Yes. Yeah. And so easy to get right, so easy to get wrong as well, unfortunately. And then the other things that we're doing, obviously you've got your medications that we can talk about as some well, we talk about them all the time anyway, but what are the other things that you would talk about when people come in, maybe about complementary therapies or other things they should be looking at doing at home?
Right. So there's a few things. One thing, I do feel that chiropractic adjustments are important, because here's what everybody thinks about chiropractic adjustments as being moving a bone. It's not about moving a bone at all, even though that's what you do. It really is a neurological therapeutic that sends two kinds of messages when you move that bone in a specific way, in a specific direction, and rapidly, which is what a chiropractic adjustment is. What you're doing is you're sending two neurological messages to the spinal cord. One prevents pain. One absolutely meets an interneuron that causes a reduction in pain. So that's a really cool, important thing. But the other thing is it sends a neurological message to the muscle to cause relaxation of the muscle that has been sort of has become hypomobile, not mobile enough. Because when a dog is in pain, of course, you know what happens. You stiffen yourself, right?
Yes.
And if you do enough of that, excuse me, if you do enough of that, the muscle ends up being in a position of spasm, or what we call hypomobility. It doesn't allow the movement of the bones. But when you do that adjustment, it then reduces pain and does allow the proper movement of bones, so the joint can be used properly. So that's one thing that's really important. Another thing, acupuncture is fantastic for pain. I mean, if there's anything that acupuncture has been proven to be effective in, it's reduced pain. It's to reduce. So that's really cool. Somebody just actually asked about that.
Yeah. Do you rate it? Yes, I think that's
I didn't even see that, and I brought it up. And then the other thing that's an emerging technology that I think is phenomenal, and there's just been a study, a randomized placebo-controlled study of this emerging technology, and that is pulse electromagnetic therapy. I'm not sure if you guys are familiar with that.
We've heard about it. We don't really do it.
So there's a thing called the Assisi loop that some of you might know of. It's a loop that you put around the dog's joint. But even better than that, I mean, the Assisi loop is great. It is very effective in it, but it has a limited number of uses. In contrast, I recommend for dogs with arthritis that the owner get a pulsed electromagnetic therapy bed. It lasts the rest of your life. In fact, every dog that comes to my clinic is treated that way. The bed is part of my exam room, and the dog is on the bed. So it's shown to reduce pain and improve healing. And if anyone's interested, the company that I use, it is in Connecticut in the United States. It's called Respond Systems, and their website is respondsystems.com. And for this investment, it's probably depending on the size of the dog, between a 400 and 600 pound bed, but it lasts the rest of your life for all of your dogs. And the science is emerging there that this is really an effective treatment. So that's something that I recommend as well.
Okay. Yeah, I've just put the link down there. And what about laser therapies?
So laser therapy can be effective. It's really a healing therapy. And it does, you have to be careful. It really should be done in the hands of a professional. There are many people who will sell you a laser, and they'll say it's a really good laser, and it'll cost you 800 pounds or 1,000 pounds or even 400 pounds or 500 pounds. Don't waste your money, because they're not effective. You can buy a laser pointer, and it's not going to be effective for treating your dog.
No.
So beware of that, because there's a lot of charlatans out there selling.
There are, yes. It's something that I get asked quite a lot, because people see other people have got them, and then say, do you think it's worthwhile getting one? And, some of them have been called like very expensive light bulbs, this kind of thing.
And the other thing, speaking of expensive light bulbs, is you'll probably see people that are selling infrared therapy pads, that have infrared therapy. And I can just tell you that it may it doesn't get through the hair coat. Less than
Right.
5% of light gets through the hair coat.
So it's really
So
not.
it's basically a really, really expensive heating pad.
Okay.
So be careful of those things. I mean, I've called the companies. I've asked them for any proof that they have. Do they have any science? No, we don't have any science. But, people report to us that they're great.
Yeah.
Sorry,
That's not really enough.
It's not good.
Yeah. So all those therapies then, would you still say that acupuncture is it is acupuncture your favorite one, do you think?
I would, I don't know that I have a favorite. I mean, the post electromagnetic therapy is great because a dog owner can do it themselves with their dog all the time. They don't have to make an appointment. And once you've made the investment for the bed, you never have to spend an investment again. So I think that's great because it's owner directed.
Yeah.
The chiropractic and acupuncture are veterinarian directed. I'm not sure if you have the if in the UK you can do it without veterinary certification.
No, but definitely not acupuncture. No.
Yeah. But but I tend to prescribe them for dogs with arthritis as often as a person can manage, because it involves an appointment and traveling, etc.
Time. Yeah. Just a quick question from Rosemary about the electromagnetic therapy. Can the pulsed electromagnetic therapy be used for an epileptic dog, as far as
To the best of my knowledge, absolutely. But when you talk to Response Systems, ask Lisa at responsesystems.com. You can ask her. She is my contact person, and she's great.
Okay.
But to the best of my knowledge, I mean, I know lots of epileptic dogs that are using them without problems.
Yeah.
So
yeah, hopefully that should be okay. The question about massage therapy. What do you think about that?
I think massage therapy can be good. The problem here in the US, and I don't know if that's a problem in the UK, but we have no certification system here in the United States that is a known, accreditation system that would state that this person has all the anatomical knowledge and the physiological knowledge and everything. So it's a bit of a mixed bag here. And I don't know if that's the same where you are.
Yeah, no, I would say that's probably the same here. Yeah. Sorry, one more question about the electromagnetic one. Are there contraindications for malignant tumors?
Not for electromagnetic therapy, but yes, for laser.
Yes. So we definitely shouldn't do it.
But not for the electromagnetic therapy.
What about TENS treatments? Is a question.
So TENS can be very, very helpful for pain. And so I particularly use it in dogs with back pain. It can be used by a person, an owner, if they know how to do it. It doesn't require you to shave the coat as long as you use lots of goop, ultrasound gel. So it can be really helpful. It's used. You should find out how to use it, because a TENS unit can be used to stimulate muscle contraction over a specific muscle. That's not what you want to do. What you want to do with TENS therapy is to connect the electrodes in an X over the area of pain. So it kind of confuses the neurological system in that area. It's called surround and drown. Basically, that's what it does to the neurological system in that area. So it stops neurological pain. So you would want to learn exactly how to use it.
Yeah. That makes sense. I've never really revisited this, but when I did give birth to my first child, I had the TENS machine, and I don't think I used it properly, because if anything, it just caused more pain. I think it's probably because I didn't really understand how to use it properly.
You were using it and it was contracting the muscles that were painful, as opposed to sending a neurological
distraction
signal to tell the neurological system shut down.
Yeah. So I quickly sold that on. Didn't ever want to use that again. There was a question up here. I just wanted to have a look at this. Tara, I'm sure there will be exercises in the link that we have about the videos.
Okay, so older dogs having trouble getting up. This is one of two things, or both things together. So the dog becomes weaker in the rear more quickly than in the front, because the front bears 60% of the dog's weight, and the rear only bears 40% of the dog's weight. So even when the dog's just hanging out, standing up, they're using more muscular effort in the front than the rear. So it can just be a disuse thing as the dogs start to, as dogs, as in old age, dogs and humans start to lose muscle. If you lose it uniformly, that's going to show up in the rear earlier because that's not using it as much just for standing. So there's that. But there also are lots of dogs that are arthritic, and that's why they're not being able to stand up from laying down, or both. Oftentimes both, because one of the features of arthritis is the dog uses their limbs less, and so then they don't get as much muscular exercise, so they get muscle atrophy. So the short answer to your question is exercises that focus on rear limb and core strength. And in my Fit for Life exercises, the cool thing about that video is the set of videos is that in the packaging or in an attachment, if you're getting it from Vimeo, it lists which exercises focus on the front, the core, and the rear. So you can actually select the ones that are most appropriate to the core and the rear for a dog that's having trouble getting up from a lying down position.
Fine. So looking at core as well is really important there. What about using things like harnesses, or not harnesses, but slings to help dogs?
Right. So there's a great product called the Help 'em Up harness.
Yes, we get them. Yes.
I love those. I mean, they really help a person support their dog, help them to get up, help them to get into the car, help them to get onto the bed. A dog can wear that all the time. They're beautifully fit. You can fit them to any dog of any size or shape. I just fit them actually recently to a little 8-pound dog, all the way up to the really gigantic breeds. So that's the only one that I would recommend. I don't recommend other harnesses or there are some units that you can buy that go around the dog's abdomen, but I think that hurts if you don't also support the rear limbs, because you're causing flexion of the spine, and then if the dog has arthritis of the spine, it's going to be more painful, etc. So the Help 'em Up harness is really the one that I like. That's the one I would recommend.
And you could use that in conjunction with the exercises in order to help your dog achieve.
Yes, definitely.
The end goal. And it's not that you're expecting them to do this alone. You do need to help them. And I think one of the comments you were saying before is that the dog's owner is the person that has to make the decisions for them, of course. And so, but you can't just present them with, you have to do this, this, and this. You have to get involved, don't you? You have to really commit to it, really.
Think about it like, I keep telling people to think about it like yourself. Wouldn't you love to have someone help you resolve your issues? I mean, and like, what if you were, what if your child, for example, was autistic and nonverbal or had some other issue? You would be doing everything you can to try and figure out how they feel and make them comfortable. And it's really the same thing.
Yeah. It makes perfect sense, doesn't it? Just a quick question back about the omega-3s here. I have a 13-year-old dog with very arthritic stifles. If I start her on omega-3 supplements, is it too late? Basically?
It's not, because it's anti-inflammatory. And it's the inflammation her arthritic stifles are causing, sending inflammatory molecules out into her body at all times. And this will suppress them.
Yeah. So never too late to start those things.
Exactly.
There's another one about, so Amanda's just written here about any thoughts on Librela. I'm not ignoring that comment, Amanda. It's just that in the States, they don't currently have it.
We only have it for cats. And I don't work with cats. So I've heard it's wonderful for cats. And we're all sitting here on pins and needles waiting for it to be released for dogs.
Yes, we're going to have a cat month later on this year, so please watch out for anyone that has cats. We'll almost certainly be talking about that. But yes, no, we won't comment about that because we don't really know in the States about that. Is there a too much for the electromagnetic or cold laser?
I don't think so. Not for the electromagnetic bed. My guys are lying on it all the time. I have 2 of them, one in my practice and one at my home. And I tell you what, the dogs fight to get on it.
I was going to ask that. Do they choose to go there?
Choose to go there. And the thing about it is you can put up to 2 inches of bedding on top of it. So
Right.
you can put their favorite bedding on top of it. Initially, what if a dog, like sometimes a dog doesn't use a bed, then what I'll do is I'll put an exercise pen around the bed and have them spend time in the exercise pen, which is going to be on the bed. But what I find then is that they start to select to go to the bed.
Mm.
And I'll tell you, this is totally anecdotal, okay? But I'm going to tell you, I personally had hip bursitis in both of my hips for 2 years, to the point where I couldn't sleep at night. I would toss and turn. I couldn't find a comfortable position. So I sat on a PEMF bed for 30 minutes a day for 2 weeks, and I've never had hip bursitis again.
Really?
Amazing. So
do they do these for people, or is this
no,
just...
I sat on my dog's bed.
Yeah.
But
Why not?
they are making them for humans now.
Are they?
Yeah.
Okay.
We're way ahead in the dog world in some ways.
Which, is nice until we get our own problems. I don't know much about this, but I used a back on track leg wrap. Does that make sense? Do you?
Yes.
On my previous dog who had arthritis in her wrist, which caused swelling to the joint. The wrap has infrared technology, CAM, as in we have it in our CAM shop. What would be better to use if the infrared doesn't work?
I'm confused because you're saying you used the back on track leg wrap on. Oh, I thought it was on a rear leg. Okay, I got it. I can't read apparently. It caused swelling to the joint. That's really interesting. I would suspect it was probably too tight. That's what I would suspect, because Back on Track is the only company that I recommend for these kinds of things. I love their coats for dogs, because they go all the way down. They cover all the major muscles. Like, why would you have a coat that stops on the dog's back? Makes no sense whatsoever.
Yes.
I love the Back on Track coats, and I actually, and in the days when I weighed 60 pounds more, I used to use it on my knees.
Oh, did you as well?
I no longer have to. Amazing.
Coats are one of those things that's only really twigged with me probably in the last 2 years, how important it is. And we'd talk about coats in the cold, and I think a coat's a coat, but actually, and it made me just think then that actually I've changed my view on them. So sometimes now when I see a coat, I think it's not good enough. It's not covering.
Yeah.
It's not providing.
Why would you have it sitting on the dog's back like a jockey saddle?
Yeah.
Makes no sense.
But it's not something you would think about unless to some people, a coat is a coat, unless you really start to look into it and think about it more.
Yeah.
But yeah, little things like all these things are just, arthritis is not, you've got arthritis, you do this.
Right.
You've
got to attack it at many points.
Yeah. Yeah. And also change it. If it needs changing, reassess. I mean, when you have a patient, how often are you reassessing them?
Depends on how severe it is. For dogs that I've got set up with a program, and I know that the person's following the program usually every 6 months. But honestly, when dogs are acutely painful and I have them on medications, I'm usually rechecking once a month, because we're going to modify the medications. We're going to modify all the ways we're hitting this to make sure we get the ideal combination. And something that you guys should know is that dogs react very individually to non-steroidal anti-inflammatory drugs. If you give them one drug and they don't respond, it doesn't mean they're not going to respond to another one. You need to try another one.
Yeah.
And so that's one of the things that I'm going to be managing at monthly visits. Give them a month to see how it's doing, and then we're going to readdress that.
And do you find then that also works with maybe a dog that did do well on one non-steroidal, but a year later it doesn't seem to be having the same effect? You would still maybe try change.
I might try changing it at that point, but I'm also going to look at all the other points that we're hitting.
Yeah.
To assess whether we might need to change that combination of issues.
Yeah. And also, just because there's a couple of questions about things like underwater treadmill, hydrotherapy.
Right. So underwater treadmill is a great way to build muscles on dogs that are having difficulty or painful supporting their weight. Absolutely.
Mm-hmm. It takes that pressure off, doesn't it? It's less impact then, and easier for them to work their muscles.
Yeah.
But yeah, nothing alone in most cases is going to be enough, apart from maybe the weight loss early on.
Oh, that's just an absolute no-brainer. That's just like the biggest thing. When there was a study where they looked at the response to various things for dogs with arthritis, and they had this graph, okay, and they showed how much does, and it was objective measurements of using a force plate, and it showed how much does NSAIDs help. Well, it helped this much, and then they showed how much does omega-3 fatty acids. Oh, it helped this much. How much did weight loss help? It helped this much. You know, it's better than any therapy, anything we can think of. It's like the number.
Yeah. I mean, I think it's always worth mentioning. We probably mention it in 90% of our lives that we do on camp, just because it is so important. That little question, what's with the Bowen? Sorry, I'm looking back at this question here. McTimony chiropractor and Bowen therapy. I don't know if I know anything about Bowen therapy.
Yes, those are both fine. Those are both good and recommended.
Yeah. And how do you access the quality of a joint supplement when there are so many on the market? Well, I think, Tara, really go to the source of the omega-3s rather than...
If you go to my book, there's a whole section on how to do that. And also, if you look at my video, you should tell them about my video on seniors, because in senior, what I did in my video on taking care of senior dogs, I'm so excited about this because I really am proud of myself on this. What I did, I took a new supplement that is being advertised extensively here in the United States, and I walked you through how I assessed it. What did I do first? What did I do second? What did I see on their website? Where's the scientific basis? You know, all of that. And you can, I think that you can see that. So both in my book, Discovering Your Dog, and also on that webinar.
So I'm going to put the other webinar up there as well about the arthritis one.
Yes. I also have a webinar about arthritis, multimodal management of arthritis. A lot of it, you'll see, it'll really confirm a lot of what we've talked about here.
Yeah.
With all the data right there, you know, the milligrams and the names of the products, et cetera, et cetera.
So there was a question about, have you put the dose of the omega-3s in your book as well? Yes. So that is there. And I can see somebody has already gone and bought the book as we've been talking. Hannah. There we go. Hannah just ordered Fit for Life on Vimeo. And I will probably do the same, I would imagine, after this, because I also want to have a look at those exercises, because I just think it's brilliant that we can do. It just makes, you know, when we're talking about the human and dogs and why we don't do the same with both. Well, we do loads of exercises with people when they've got an issue, or athletes and conditioning. Why the heck wouldn't we do it for dogs as well? Of course we should. It's just making sure they're doing the right ones, really. And then there's a question there from Mandy about, can you send a link to the graph about the NSAIDs? I think I might be able to find it. It's in
my, let me think. It's in the, I've shown the graph multiple times in my video on arthritis. And I showed at each of the points, here's what the response to non-steroidals were compared to everything else. Here's the response to weight management. Here's the response to omegas. So I showed that graph multiple times in that.
So have a look. I've just put the link there of the on-demand arthritis one that you can see. And I'll put it in the block of information that we put at the beginning of the live as well once we've finished. But yeah, more people in basket. I've just bought the videos. Fantastic. So I'm going to, I'll have a look back at these questions after and to see if there's anything else I can answer. But I'm going to bring this to an end because I know it's sort of your mid-afternoon. You've probably got things to be getting on with as well. So thank you so much for joining us. I've really enjoyed it, and just loads of questions from my own mind and from our viewers as well. And if anyone does have any more questions, please do pop them down and I will try and get some answers for you, or have a look in the books or on the webinars, because it's probably all there, I would imagine.
Yeah, everybody, you know, I'm so passionate about sharing what I know that are answers and that are fact-based, evidence-based answers.
Yeah.
I think I was, I know it's maybe going to sound a little corny, but I really think I was put on earth to pass on this information to everyone so that dogs can, and their people, of course, because if your dog lives a high quality life, so are you.
Yes.
And yeah, so that's That's my passion. And so
no, you can tell, and everything that you say, so it's understandable as well. It just makes perfect sense, from what you're saying. Yeah, here we go. I can feel your, Janice, but I can feel your passion through the screen. Thank you for all you do for us and our dogs. So.
Sometimes I'm a little over passionate, but anyway.
there's no such thing. What I will just mention before we go is the member zone on CAM. So everyone that's followed us for a long while will know that CAM's been around for a long time, initially as a Facebook page, and then the website, which has now been renewed and redeveloped, and there is now a member zone which has a lot more information in it. So if you want to join the member zone, it's £25, really good value, and it has all the access to the courses that Hannah's done, and the CAM Essentials course, and all her the downloadable booklets. It's also got a member zone forum, and she runs a tea and chat once a month that you can join and ask any questions and just comment and just really get involved.
Tea and chat.
Tea and chats, because I think arthritis, is one of those things that it's not going to go away. It's not curable, and there are lots of people, thank goodness, like Dr Zink out there who really want to help and who really want to get the information, and if we all work together, we can just make our dogs' lives as happy as possible, really, which is at the end of the day is all we want. So thank you very much, everybody, and thank you so much
for coming, everybody. I enjoyed all your really intelligent questions and your passion too, because it's obvious you really care about your dogs. I love that.
Yeah. No, thank you, everyone. Have a lovely evening, and we'll see you again soon. Bye-bye.
Bye-bye.